Stroke is a condition of the brain in which one of the blood vessels becomes blocked either temporarily or permanently and blocks blood flow to a portion of the brain. Then, depending on which portion of the brain was affected, that would determine what kind of symptoms the person might have. So it may be numbness, tingling, weakness, speech problems or language problems, problems with walking, or a change in their mental status. The typical risk factors that we think of are high blood pressure, diabetes, high cholesterol, age, gender, being a man is a greater risk factor for stroke, and tobacco use. The other thing that is not in the past is recognized as a stroke risk factor also is sleep apnea. So if someone has underlying sleep apnea, then we can try to address that and reduce the risk of stroke as well. If someone develops any sudden onset of any of the stroke symptoms I previously mentioned, sudden numbness, tingling, weakness, change in their mental status, speech, gait, then they should call 911 immediately. There are some medications and treatments that are available now in the early window from the time of onset that if people can get to the hospital quickly enough, they may be a candidate for those treatments. Time is critical because there are treatments available in the early onset of stroke. So typically within the first 4.5 hours now, we can use an intravenous medication called TPA. And beyond that window, there may be some other treatments available at tertiary care centers. Right now, I'm working with the hospital administration and members of the hospital staff to try to establish Genesis as a primary stroke center. We'd like to be a leading provider for stroke care in this region, and by establishing that certification, that will help us in the future.